Hello, I'm Dr. Rhonda Johnson. Today is Sunday, November 10th, 2024. Today I'm talking about bird flu, what you need to know. So the current status is that the United States has reported 46 human cases of bird flu, also known as H5N1 and avian flu. Now, California and Colorado have the highest case counts. All patients have recovered fully. There's been no person-to-person spread so far. Now, there is a new development. The bird flu has now been found in 2 pigs on an Oregon farm, and the infection came from wild birds, not dairy cows. Now, pigs are concerned because they can carry both bird and human flu, which might lead to new flu strains that could affect humans. So should you be worried? Well, the CDC says the general public risk is low. Now, people working with infected animals have a higher risk, and they should use PPE, like gloves, goggles, and masks to stay safe. So how does this infection spread? Well, bird flu can spread through contact with infected animal saliva, droppings, or respiratory droppings, often from touching or inhaling dust in animal habitats. Symptoms to watch for include fever, fatigue, cough, sore throat, muscle aches, red eyes, vomiting and nausea. And if you have been in contact with infected animals, see a healthcare provider if you're sick and tell them about your exposure to these animals so they can test you for bird flu. So what about the flu vaccines? Well, the seasonal flu shot won't protect you against bird flu, but it will help you against other influenza strains. So stay safe, folks. Stay informed. I do not think people need to panic. I'm sharing this information for informational purposes only. I think that wastewater is being monitored, and levels have been shown to be primarily coming from infected animal sources, and we just need to be vigilant. And the USDA is testing, the CDC is testing, so hopefully this monitoring will continue with the new administration. That's my message, and I'm going to do another video on how to protect yourself. So please watch that one as well.